Do you need a PhD or at least a master's to be a medical writer? The short answer is no. The longer answer is it depends on which type of medical writing you want to get into. So there are some people who get into medical writing and they've just got a Bachelor of Science degree. And there are some people who are still studying at university, so they are undergraduates, and they can be medical writers too. So there are different types of medical writing, and the level of skill or your degree that you need if you want to get into it depends on the type of medical writing. So, for example, if you want to do more regulatory or clinical trial type medical writing, then that would probably need a master's or a PhD. But if you want to write health information for patients or create social media content or go more into marketing, then it's less likely that you will need a PhD or a master's for that. So for me, I have a Master of Pharmacy degree. So because I practiced as a pharmacist for 7 years before I became a medical writer, I have a lot of clinical expertise and knowledge and interaction with patients. So that gave me a really big advantage and helped me get into medical writing and also charge more money from the very beginning. So if you are a student thinking about getting into medical writing, do not do a master's or PhD just to become a medical writer. You can do so much more with a master's or PhD. For me, I got into it because I moved country, and so I couldn't be a pharmacist anymore in Germany because I couldn't speak German. And so medical writing was something that I could do. I could work from home, and also I really wanted the flexibility to travel wherever I want. So with that flexibility and with those advantages come some disadvantages. So there is kind of a lack of consistent income, I would say. So for me, I got made redundant twice, and so I had to learn how to be a freelancer. And when you're a freelancer, the reality is that you are always looking for work, but you want to try and be smart about it. So you want to try and have long-term clients, you want to have retainers, which means that you get the client to sign up for long-term work. So rather than just giving you one project, you have a 6-month project. So you know that at least you're going to get income for the next 6 months. And to be fair, when you're an employee, there's no guarantee that you're going to keep your job anyway, because they can give you however many months notice. So you do not need a PhD or master's to become a medical writer. And even if you do not have a science or medical based degree, then you can get into it. It just means that it's going to be harder and you're going to get lower pay. So being a writer is still a great job. It offers you a lot of flexibility, and I would recommend it to anyone. But ultimately, it's not for everyone, because some people will get into it, they'll think it's easy, but there is a lot of kind of technical background to being a medical writer. And so I would recommend that you try it out. And it's one of those things that you could possibly do as a side job, but when you get serious about it, you obviously make more money and you have better relationships with clients. So there are some people who've been medical writers for 20, 25 years because they've always been able to find work. Now that more people want a more flexible lifestyle, there can be more competition. So if you do have a PhD or master's and you're looking for an alternative job, then medical writing would be a good one to get into, because having those higher degrees will help you, higher education degrees will help you get the advantage to become a medical writer over someone who is an undergraduate or student. So there is a market, of course, for people who do not have degrees, and that's usually for trainee work. And usually agencies will take on trainees, or maybe a charity or a non-profit. So if you just want to learn the skills of medical writing, then you can do that at no cost, but you might not get paid for it because you are benefiting from the training. So I would recommend that if you do want to get into medical writing, think about it, try it out, do a few jobs with some clients, try to get an entry-level job to get the training. And just like anything in life, you do not need to stay in it forever, but once you learn the skills, it's really useful as a life skill, and that's why I'm still doing it, and I'm moving into lots of different things like video, which I really enjoy. So I hope that answers your question, and good luck.